Hello and welcome to my channel OcuTalks. I am super excited to have you here. So today our topic of discussion would be topography of the retina, which is the innermost delicate light sensitive layer of our eye. Moving forward, we will be covering the following contents. First, we will get a general introduction of what retina is, and then we will move on to the different structures that are involved in the retina. Coming to the introduction first, what is retina? The word retina comes from the Latin term rete, which means net. And that makes pretty much sense because the retina acts like a neural net, capturing light and converting it into electrical signals that our brain interprets as vision. The retina is actually an extension of the brain. It develops from the same tissue as the brain during embryonic growth. In fact, it's the only part of the brain that can be directly observed without surgery. This makes retina an incredibly valuable tool for diagnosing any ocular or systemic condition. By examining it, optometrists and ophthalmologists can detect real-time changes in the nervous system, helping diagnose conditions like diabetes, hypertension, and even neurological disorders. Next, we move on to the topographical anatomy of retina. As we have already discussed, that retina is a delicate light-sensitive structure that lines the inside of the eye. It extends from the ora serrata anteriorly to the optic disc posteriorly, covering a surface area of approximately 1100 mm square. The retina isn't a flat structure as we can see in the picture. It has a curvature. The radius of curvature varies between 8 to 12 mm, averaging between 11 to 14 mm. Along the horizontal meridian, it spans approximately 32 mm from one end to the other. The thickest point is the optic disc, measuring 0.56 mm. As we move outward, the retina becomes thinner. Near the ora serrata, it's about 0.18 mm, and at the equator of the eyeball, it's as thin as 0.1 mm. Next, we move on to an important structure of the retina, that is the optic disc. It is a crucial structure in the retina that serves as the gateway to the optic nerve. The optic disc appears as a pale pink, circular to slightly oval structure and measures approximately 1.5 mm in diameter. Compared to the rest of the retina, the optic disc looks whiter due to the presence of lamina cribrosa, which is a specialized sieve-like structure in the sclera, and the medullated nerve fiber layer. All the retinal fibers terminate at the optic disc, except for the nerve fibers which pass through the lamina cribrosa and continue as the optic nerve. This is where visual information leaves the eye and travels to the brain for processing. So while the optic disc plays a critical role in vision, it also has one limitation. It contains no photoreceptors. Now, what are photoreceptors? Photoreceptors are specialized organs that help in our vision. So we can conclude that it creates a natural blind spot in our vision. Fortunately, our brain seamlessly fills in the missing details so we don't even notice it in everyday life. Alright, let's now talk about an important feature of the optic disc, the physiological cupping. At the center of the optic disc, there is a small depression known as the physiological cup. This is where the central retinal vessels emerge, bringing essential nutrients to the eye. Now, here's the interesting part. The size, shape, and depth of this cup can vary from person to person. In some cases, there is very little cupping, making the optic disc appear more uniformly pink, with vessels dividing before they reach the surface. However, when the cup becomes abnormally large, or if there is a significant difference in cup size between the two eyes, it raises suspicion of glaucoma, a serious condition that can lead to vision loss if left untreated. Now let us take a look at the image on the right. The normal optic disc has a small and shallow cup with a healthy neuroretinal rim around it. In glaucoma, the cup is enlarged, leading to a high cup to disc ratio, which is a key indicator of the optic nerve damage. That's why early detection of these changes is critical for diagnosing and managing glaucoma before it causes irreversible damage. Now let's shift our focus to an important region of the retina, the area centralis, also known as the central retina. This specialized area measures about 5.5 mm in diameter and is found at the posterior fundus, just temporal to the optic disc. It is anatomically defined by the upper and lower arcuate retinal vessels and has an elliptical shape horizontally. From a histological perspective, the area centralis is further divided into key parts, and they are macula, perifovea, parafovea, fovea, foveola, and umbo. It corresponds to approximately 15 degrees of the visual field and is primarily responsible for photopic vision, that is, vision under well-lit condition. It is also crucial for color vision, making it essential for detailed and sharp visual perception. In the upcoming slides, we will know why the area centralis is responsible for color vision and sharp visual perception. Next, we move on to the first structure of the area centralis, that is macula lutea. As described in the slide, the macula lutea is an oval zone of yellow discoloration within the central retina. It measures about 5.5 mm. It cannot be easily distinguished in an ophthalmic examination of the living eye except in red-free filter. In dark pigmented individual, it is visible as a horizontal oval zone with fovea at the center. Now, interesting fact is, in a freshly enucleated eye, the zone appears as a greenish-yellow elliptical zone, about 3 mm in diameter, with the center being at the foveola, which itself is colorless. A study was done with the help of an optical device which showed the region as a faint yellow colored region and having a diameter of approximately 5 mm in central retina. Thus, there is an apparent confusion in the use of the terms area centralis, macula lutea, and macula. Macula derives its yellowish appearance from oxygenated carotenoids, particularly lutein and zeaxanthin, which are present in the bipolar and the ganglion cell layer of the retina. In our next video, we will have a detailed talk about the different layers of the retina. These pigments act as a short wavelength filter and protect our eye from UV radiation. Moving on to the next zone, which is parafovea. It is a 0.5 mm ring which is surrounding the fovea. It includes the peripheral foveal walls. It is the margin where ganglion cell, inner nuclear layer, and outer plexiform layer is the thickest. We can see the largest accumulation of neurons in this region of the retina. Next, we have the perifovea, which is a 1.5 mm wide ring surrounding the parafovea. It extends from the outermost limit of the parafovea to the outermost limit of the macula lutea. Moving forward, we come to an important structure, which is the fovea centralis. It is a central depressed part of the retina. It is concave central retinal depression that measures about 1.85 mm in diameter, which approximates one disc diameter. Now previously I have discussed in the slide of optic disc that an optic disc measures about 1.5 mm in diameter. So this depression approximates one disc diameter. It is 0.25 mm in thickness and is about 3.4 mm temporal to the optic disc, which is approximately 2.5 disc diameter. It is formed by the centripetal displacement of the outer retinal layers. The layers that are present in the fovea are the retinal pigment epithelium, the photoreceptors, the external limiting membrane, the outer nuclear layer, which contain the nuclei of the cone cells, the inner fibers of the photoreceptors, which we call as Henle's fiber layer, and the internal limiting membrane. Now mind you, when I am saying about the photoreceptor layer consists of two types of cells, the rods and the cones. For the time being, you can remember that rods are responsible for night vision and cones are responsible for day and color vision. Since only cone cells are present in this region is responsible for day vision and color vision. The fovea has a margin, a downward slope and a floor which is known as foveola, which we will be discussing in the next slide. At the center of the fovea, there is a lateral displacement or centrifugal displacement of the inner layers of the retina so that a central concave indentation is produced, which we call as foveola. The foveola measures about 0.35 mm in diameter and 0.13 mm in thickness. It is situated about 2 disc diameter away from the temporal edge of the optic disc and about 1 mm below the horizontal meridian. Now as we can see that foveola is a 3D structure which has a margin, a slope and a pit at the bottom. The downward sloping border which starts from the margin and meets at the floor of the foveal pit is known as clivus. It represents the area of the highest visual acuity even though it is just about 1 degree of the visual field. Similar to fovea, the foveola is also composed of the same layers. What are the layers? The retinal pigment epithelium, the photoreceptors where only we have cones, the external limiting membrane, the outer nuclear layer which contains the nuclei of the cone cells, the inner fibers of the photoreceptors, often known as Henle's fiber layer, and the internal limiting membrane. The absence of blood vessels and the light scattering inner retinal layers enhances the optical quality of the foveal pit by removing angioscotomas. Now what do I mean by angioscotoma? An angioscotoma is a small shallow visual field defect caused by retinal vessels. It has been shown that the maximum concentration of the cone is present in this region of the retina, allowing it to have the best visual clarity. Because the cones do not form fully until many months after birth, a newborn's central focus is imperfect. Next, we move on to the pit region of the fovea, which is also known as umbo. The foveal pit is around 0.15 mm in diameter. It is almost devoid of layers beneath the photoreceptor layer. It consists of mainly cone cells and cone-shaped region of the molar cells. On the edge of the foveal pit, the foveal slope is still mainly devoid of other layers, but there is some evidence of presence of some cell bodies of retinal interneurons, bipolar and horizontal cells, and even some amacrine cell processes. Next, we move on to foveal avascular zone, an important structure in the central retina. It has a diameter ranging from 250 to 600 micron meter. Some literatures also suggest that the diameter can be ranging from 400 to 700 micron meter. The geometric center of FAZ is often taken to be the center of macula, that is the point of fixation. It corresponds to 1.5 degree of an individual's visual field. It is located inside the fovea, but its spread is outside foveola. That means the region is spread between the diameters of fovea and foveola. This is a chart which is showing a summary of the different layers that we have read in the central retina. Coming to the first clinical pearl of this presentation, that is foveal hypoplasia. It is a condition where the foveal pit does not fully develop. It is manifested by the absence or reduction of foveal pit and foveal vascular zone. You can see in the OCT picture on the left side that in a normal human there is a pit present in the foveal region, but in the OCT picture below that you can see there is absence of pit. On the right side you will also see there is absence of foveal reflex, which we can see in case of a normal patient. Now we move on to the peripheral retina, which is also known as the extra-areal periphery. It increases the field of vision. Retinal regions based on gross anatomy, including vessels, was defined in 1961 by Duke and Elder, who categorized the peripheral retina into 4 zones. These zones are as follows: the near periphery, a 1.5 mm ring adjacent to the 6 mm diameter macula; the middle periphery or the mid periphery, which is the next 1.5 mm ring; the far periphery, measuring next 9 to 10 mm on temporal side and 16 mm on the nasal side; and last but not the least, the ora serrata, which is the extreme periphery, measuring the additional 2.1 mm in the temporal and 0.7 mm on the nasal side. Coming to the anteriormost region of the retina, known as the ora serrata. It consists of dentate fringe and it denotes the termination or end of the retinal layer. It is 2.1 mm wide temporally and 0.7 to 0.8 mm wide nasally, and is located 6 mm nasally and 7 mm temporally from the limbus. It is 6 to 8 mm from the equator and 25 mm from the optic nerve on the nasal side. The ora serrata marks the transition between the attenuated retina and the inner columnar non-pigmented cell of the pars ciliaris part. The retinal pigment epithelium continues anteriorly as the outer cuboidal cell layer of the ciliary body. So, coming to the next clinical pearl, which is cystoid degeneration. These are cystic spaces which primarily occur in the outer plexiform layer of the sensory retina at the ora serrata region. The cystic spaces become more pronounced in the elderly population. The degeneration is more prominent on the nasal side than on the temporal side. The cysts extend between the inner and the outer limiting membrane as discussed earlier, and they communicate with the vitreous, which in turn results in retinal detachment. So that's it for today. Thank you for watching the video till the end. If you find the video helpful, please do like, share and subscribe the channel. Thank you.